Good evening, Prof.
Yeah, good evening.
Good evening, Prof.
Good evening, Prof.
Good evening,
Good
all.
evening,
Good evening,
Yeah.
Prof.
Good evening, sir.
Good
Good
evening.
evening,
Prof.
sir.
Good evening, sir. Good evening, Prof.
Thank
Good
you.
evening, sir.
Yes. So let me welcome you
Good
to
evening,
the
Prof. Yeah.
good evening. Let me welcome you to this first lecture of the academic section. Okay, so as we said during the induction, these lectures are real time because we want your participation. And of course, we promise to provide the lecture materials upfront to enable you read, because we are using what we call the flipped classroom model. Flipped classroom means that instead of teaching and then giving you assignments, you will read, and then come and then ask questions during the lecture. Okay, so we permit you. Okay, we encourage you to ask as many questions as possible, but we are going to ask the questions at interval. So I will teach a long stretch, and after that, you will be allowed to ask questions. I don't want you to ask as many questions as possible. Please, there is no question that is not good enough. No question. Just feel free to ask any question you want to ask. Okay. So the first course in this MPH and of course operational medicine program has to do with the history. The history of public health. We are going to also talk about the ethics of public health and then legislation. Okay, I'm sure that some of us will be wondering why study history? Why study history? We study history for several reasons. We study history for several reasons. And one of those reasons is to ensure that great deeds are not forgotten. To ensure that great deeds are not forgotten. Because medicine, health sciences, and public health, there are several practitioners of the past. They are the people that gave the health profession. The health profession is respect. So if you go, if the present day health professionals, if they go, they introduce themselves and they are respected. It's not because of the respect the individual has for them, but it's the respect the individual has come to have for health professionals. So it is good to know about or to know some of those people that promoted the image of the health profession. And usually I give two examples. I like to give two examples. One was a Greek philosopher physician, Hippocrates, who is widely regarded as the father of medicine, And another person, Oguntola Sapara. Oguntola Sapara was one of the earliest Nigerian doctors. These two, we are going to highlight what they did. I know others did what they did, but I like to highlight what these two did. Hippocrates was born into a priestly caste, which means that
Thank you.
which means that which means they practiced, which means he was amongst those that probably the priests of a certain god, one of those Greek gods. Okay, if you worship a god, you believe in the supernatural. But Hippocrates abandoned these supernatural beliefs in the supernatural cause of diseases. And instead, he tried to explain the disease using philosophy, explain the disease using philosophy, and that's why he was called, or people like him were called philosopher physicians, because they explain the cause of disease not using supernatural as is often, but trying to explain based on nature. Okay, so this is remarkable, considering the fact that if you take a census of people attending this lecture, a lot of us, in fact, almost like more than 90% of us will still believe in the supernatural. And these Hippocrates, several years ago, more than 3,000 years ago, abandoned this belief in the supernatural. And with that abandonment, he was free to think about the possible causes of diseases, and then developed practice measures that is still being used in modern medicine. Okay, the other person I like to highlight is Oguntola Sapara. Oguntola Sapara was one of the earliest Nigerian doctors. And when he was appointed into the civil service, once more he was employed into the civil services and posted to Ekpe, there were so much, the epidemic of smallpox was so much and killed so many people that the Yorubas deified smallpox and called it Shopono. And of course, there were priests and priestesses, people worshiping the Shopono. But they didn't just worship. Anybody that died of smallpox had all his properties confiscated, confiscated by the priests and the priestesses. So it was in their interest to spread the disease. So Oguntola Sapara suspected that they were actively spreading the disease. What he did was to get initiated. What he did was to get initiated. So he got initiated, learned about the secret ways of the secret ways they are using to spread the disease, and then reported to the colonial authorities. And then the colonial authorities banned the worship of smallpox in Yoruba land, and that resulted in the that resulted that encouraged, or that led to the decrease in the epidemic of smallpox in Yoruba land. So I'm retelling the story of Sapara because he took risk. He took risk, but he took risk to protect the health of the public, and that is what we want to encourage people, especially those of us that are getting into public health. We want to encourage them to think of what they do, because that is actually the hallmark of public health practitioners. When there is an epidemic, most times other doctors will be running away from the source of the epidemic, and then but public health doctors and physicians and health workers, public health professionals will be running towards the epidemic. And even in the hospitals, even in the current hospitals, the people, different specialties of medicine, they fight over, they fight over who will manage a patient. But when it is time, when during an epidemic like Lassa, most times they just run away and then leave the management um, to public health practitioners. And the same thing with COVID and the rest. Okay, so one of the reasons why we study the history is to is to is to ensure that the good deeds of the past were not forgotten. Then the other one is that if you know history, you will understand the present, and you'll be able to forecast the future. You'll be able to forecast the future. You will be able to probably tell what might happen in the future. And in this, usually I use the example. I use the example of healing, Christian healing, right now, of healing ministry. Healing ministry is very, very common in the churches, in the Christian churches in Nigeria, and of course in West Africa. But but I if you know what happened in the medieval Europe, in medieval Europe they also believed in faith healing during the dark ages, during the medieval period. But right now they are not. Right now they are not. So we believe that if healthcare in Nigeria improves and becomes as big as good as those in the developed countries, people will no longer resort to faith healing as is currently practiced in Nigeria. The other reason is the identity of the health profession. First, the identity of the health profession. We know, we know from the deeds of people. We know how doctors act. We know how nurses act. We know how public health officials act because of what others have done. So it's by knowing what others have done, um, we can appreciate what public health or what health professionals do. And we talked about selflessness, being able to even put it oneself at risk to protect the public, as is the case of this lady Adedovo that actually played a remarkable role in curtailing the spread of Ebola in Nigeria. Eh? Ebola in Nigeria. She's basically put herself at risk, or basically sacrificed herself. Okay, so such selflessness is what is expected of public health practitioners. And then this guy, Francis Akano Ibiam, was one of the earliest medical doctors in Igbo land. Eh? But, and in those days now, he had the opportunity to be employed in the civil service, where he would have been paid 4 times more. But instead, he chose to become a missionary doctor to provide health services at little or no cost to people. So he was more interested in service than in the money. Okay, so that is also what we want to emphasize, that medical practice or health practice is not it's not a service. It's not a practice that you become a billionaire. If you want to become a billionaire, it's not to go into the health services. It's not to go into the health services, because the most important thing is not the money. The most important thing is actually to save the lives of people. And in the case of public health practitioners, to save the life of people in the community. Okay? So Francis Akano Ibiam is a good example. Is a good example. And the good thing is that he also reaped his reward here on earth, because the people of his consistency later became a politician and even became a premier of Eastern Nigeria. Okay, so service can be recognized. Service can actually be recognized. Okay, so Francis Akano Ibiam. And then the other one I have to also talk about this guy, Andres Vasselos. Andres Vasselos is probably familiar to or familiar to those of us that did anatomy, human anatomy, because he played an important role in ensuring that the correct human anatomy was taught. Before his time, they were teaching. The human anatomy was based on animal dissections. So there were lots of mistakes. And Andre Vasselos became one of those that we are called resurrectionists, because they will just go to the cemetery, exhume corpse, and then dissect. And then dissect. So with that dissection, he was able to notice a lot of mistakes in Galen's anatomy. And he wrote about those mistakes. And the good thing is that he illustrated, he made beautiful illustrations. He made beautiful illustrations and published it in his book, in his landmark book. But instead of being instead of being praised for making for correcting the mistakes of Galen, he was they set upon him, set upon him, accused him, and abused him for having the guts to challenge uh, the authority or the teaching of the great Galen. And even his students abused him. So the lesson here is that even if look for the good, try as much as possible to do good. But when you do good, please don't expect that everybody we recognize, or we recognize that you have done good. A lot of people will go against you. Or just remember that in the fullest of time, you'll be recognized. Because right now we are discussing Andreas Vasilos, who died frustrated, who was frustrated in his lifetime, but he's been discussed several centuries after. So if you see the right thing, please do it. Do it. And when you do it, don't expect that everybody will recognize that you have done the right thing. Some will, a lot of them, a lot of people will have, will, will, a lot of people will go against you. But if you are convinced, that you are doing the right thing, please persist, because history will vindicate you, as this guy has been vindicated, and he's still being taught. He's still being talked about several centuries later. The other reason is to boost teamwork. In the health sciences, in the healthcare, we work as a team. We work as a team. In the hospital, you have a team of doctors, of nurses, of even porters, or even pharmacists and med lab scientists. They all work together to take care of the patients. And in the public health, we have a lot of persons. And when we talk a little bit about of course, the history of public health, you come to know that when public health started, even we have engineers, lawyers that drafted the laws, because public health depended on law and a lot of legislation. So lawyers were there, engineers were there. The engineers were doing the construction, uh, constructing drainages and helping with toilet and sewerage systems. So they were there. Even housewives, because public health started as environmental sanitation. So those upper class ladies in Europe, they were all involved. So public health has to do with teamwork. And unfortunately, the teamwork in healthcare is being shattered. It's being shattered. So we know, or we suspect that it is because people don't know. People have forgotten the history, how the various health professions came into healthcare. Of course, originally it was with when somebody, as we are going to teach later, when somebody gets sick, the person will try self-medication. And if symptom persists, he will go to a doctor, eh? Probably in the traditional society, traditional medicine doctor. And then the doctor will come, prescribe medication. And if the person, because once somebody is sick, the person will not be able to take care of himself. So members of the household will become the nurses. And if the person, is a man of wealth, he may have slaves. So slaves and household members were the people providing nursing services. So nursing services was a low cadre, a profession of low repute, until this lady came, Florence Nightingale. Florence Nightingale was an upper class lady, and I'm sure that she wasn't married. She wasn't married because in Europe, there weren't enough men, because men were fighting and killing themselves, and it was almost a taboo to marry below their class. So she decided to join in the Crimean War. And the nursing services she provided, with the nursing services she provided, it was clear that patients recover better with good nursing services. They recovered so much that they looked forward to her visit. And she came with a lantern, and that's why they usually will say the lady with the lamp. So when she proved the importance of good nursing, when after the war, she started the professional training of nurses, and that was how the nursing profession came about. Okay, for the pharmacists, from the pharmacists, the doctors of that era of the Middle Ages were prescribing drugs made with several ingredients, drugs made with several ingredients, probably tens of ingredients. So it was taking time. It took them time to compound these ingredients to be given to the patient. So that was how that aspect of compounding medicines were seeded to pharmacists to do. But we know that that's the roles of pharmacists also have now changed, because the compounding aspects of drugs is currently being handled by drug companies. So what is basically left? What is basically left is to dispense the drugs. It is dispensing drugs. Okay, so the other professions, other health professionals, they also have a way. They also came. They also came. Uh, they also came, and we are going to talk about them, especially those professionals that are relevant to public health. Okay, so we have discussed some of the reasons we study history. Some of the reasons why we study history. So we don't study history because we want to tell tales by moonlight. No, we study history because we want to remember the good deeds of the past. We want to um, know about exemplars, people we have to, people with good practice, the people we can model our practice uh, after. And then we need to also, with history, we'll know we can build teamwork. And then with history, I think this one is even the most important reason why we study history. If we study history, we understand. If we understand the past, if we know the past, we will understand the present, and then we'll be able to forecast the future. Okay, so I have answered the reasons why we study history. I don't know if there is any question, any comment on what I have just said. If there is any question, you raise your hand, and then I'll answer before we move. Do we have any question? Okay. Hello, Hannah.
Good evening. Thank you for the lecture so far. Please, I
Yeah.
wanted to ask what specifically Adadevo did in the Ebola.
Okay. Yes, Hannah. Anyway, okay. We in Nigeria, we know, um, a Liberian diplomat got infected with Ebola and came to Nigeria. In fact, they were suspecting that he was coming to see a man of God, a reputed faith healer in Nigeria, and he collapsed. He collapsed at the airport and was, of course, rushed to the hospital. And this Adedovo, doctor, yes, this Adedovo was the one that suspected that he might have Ebola. And that was how he started managing quarantine, of course, isolated him, and then ran the test, and he came out to be uh, an Ebola patient. Unfortunately, Adedovo the doctor got infected and died. Yes. So she paid the supreme sacrifice. So if she didn't have that high index of suspicion that led to the diagnosis, perhaps he could have got into the synagogue church of all nations, where the way they do their healing, he could have infected a lot of persons. He could have infected a lot of persons. And that could have been a serious problem because all people from all walks of life, they visit the church for healing. And you will wonder, you can imagine what would have happened. And that's why we try as much as possible to hold her up. To hold her up as an example of what someone can do to ensure the health of the public. Okay. Hello, Amota.
Okay, good evening, Prof. And
Yeah, good evening.
good evening, fellow students. So, Prof, I was just, as you were, highlighting the history and emphasizing the role that brave people took to champion public health advances. I couldn't help but think about the recent COVID pandemic and the vaccines, the new line of vaccines, messenger RNA type vaccines
RNA.
that have never been used before, and the
Never.
skepticism, and I'm wondering if there's a balance, that we as public health professionals seeking, have to be cautious with the introduction of such new, novel type of interventions. Thank you.
Actually, it was fast-tracked. Was fast-tracked. But the thing is that it was that RNA vaccine stuff has been it's something that they have been working upon, because even the hepatitis B vaccine is there is a new one, was a model along that line. But I understand. I understand because of the likelihood, because of the risk of when you talk about RAD, the risk of getting incorporated into the genome is there, and that can result in this thing. But I know that in medical practice, which I know you have an experience of, it has to do with the cost benefit analysis. When you are faced with anything, is the cost benefit analysis. After all, the drugs we use in treating patients are actually poisons. One of the best definition of a drug is a poison taken in small doses. Okay. So everything is a cost benefit. You weigh the cost and the benefit. And if you think the benefit exceeds the cost, then you go ahead with it. Okay. Thank you. Hello, Choma. Hello, Choma.
Hello, Prof.
Hello.
Good evening.
Yes. Yes.
Yes, good evening. Thank you for the lecture. So mine is in relation to the area of, where you mentioned about fake healing. And I know that's something that is a little bit sensitive, but I wanted to get clarification. Like, can we say like all fake healings are not totally true, especially in areas where it is step forward? We talk about.
Choma, we are going to talk about that in the next in what's the next one, because it has to do with placebo, and we want to tell you how it goes. Thank you. Yes. So let's just move on. Let's start with the evolution of diseases, and yes. So the first one is the first sign of infection. Infection is the introduction of probably a microorganism into the body. So it is assumed that the mitochondrial is the first sign of infection. Mitochondrial is the first sign of infection, or the first evidence, or the earliest form of infection. And then why are we saying that? It has to do with the presence of mitochondrial has its own genetic material, unlike the others, unlike the other organelles of the cell. So because it has its own, it is assumed to be probably a virus, probably a bacteria, probably a bacteria that got incorporated into the cell, and right now is the main powerhouse. Is the main powerhouse. So the first sign of infection is mitochondria. But we have to also know that there is difference between infection and a disease. Infection is the presence of the microorganism. Disease is the manifestation of the side effects. Okay, so the evidence of diseases in human beings are very difficult to know. They are very, very difficult to know because diseases often affect the soft tissues, and soft tissues, they decompose and they become dust. Bones stay for a longer period, and of course we could see there are several evidence of diseases in bones, including even bone cancer have been found. Bone cancer have been found. Okay, so but the evidence, one of the earliest evidence of human disease is found in these small statuettes, the Venus of Willendorf, which is a limestone statuette worshipped by the early men as goddess of fertility and childbearing. So I'm sure that you just look at her. There are reasons why she was so worshipped. For example, she has prominent breasts. So it's assumed that with the prominent breasts, breastfeeding won't be a problem. And of course, if you look at her waist is big, it's large, which means that the baby can easily pass through. The baby can easily pass through. So childbirth is not likely to be a problem. Wasn't a problem to her. Okay, so these are the reasons why she was worshipped as a goddess of fertility and childbearing. Okay, but she also has signs of disease. And if you look at her, she's on the obese side. She's fat. Although in our societies, there is a tendency not to see fat or fatness as being a sign of disease. In fact, we think that it is a sign of affluence. But we know that obesity is a risk factor for several diseases, including hypertension, including diabetes, including even certain cancers. Certain cancers. But not only that, if you look at the nails of the woman, you will see that they are swollen, which means that she had arthritis, which means that she has arthritis. She has arthritis. So we can say that the Venus of Willendorf is one of the earliest signs of disease in a human being. Okay, so we got that. Okay, the other one too. There are actually two types of diseases. We have the endemic diseases and the epidemic diseases. The endemic diseases are diseases that are constantly present in a human population. They are constantly present in the human population. At times they kill. But they kill at a proportion, at the number. They kill the number that members of the community are used to. They kill at the rates members of the community are used to. So endemic diseases. So because of that, people with endemic diseases like malaria, they treat themselves. They treat themselves. Eh? Okay. And the other type of diseases are called epidemic diseases. Epidemic diseases, they are not always present in a population. Eh? But when they occur, they kill a lot of persons. They kill a lot of persons. Because they kill a lot of persons, members of the communities, members of the community will be scared. And because members of the communities are scared, there is a tendency for them to pull together, gather together to fight the disease. Gather together to fight disease. So, which means that the treatment of epidemic diseases are usually a community effort. Are usually a community effort. Community effort because members of the community will think that every other member of the community are under attack. Mostly because the disease, a strange thing, a strange disease has afflicted several members of their community, and they are killing and have killed them. So usually they band together to do something. Okay. So just as I said, that these endemic diseases are usually treated by individuals. And usually they start with self-medication. They start with self-medication. They start with self-medication. And the self-medication they use, the drugs they use are called folk medicine. The drugs they use are called folk medicine. And folk medicine are medicines that are known to everybody in the community. Folk medicines are known to everybody in the community, okay, especially the women, because women are the main caregivers of the household, okay. And this folk medicine are not even those that are, those that are not aware of them, they are not sold. They are not sold. They are made easily available to people. They are made easily available to people. So this folk medicine, it is believed that this folk medicine were brought from the animal past. So when human beings evolved from apes to become human beings, they brought with them this folk medicine.
Sorry, I did class. You know that they go school.
Because folk medicine has actually, examples of folk medicine have actually been found amongst animals. For example, recently, chimpanzees in Uganda were found to actually use herbal drugs, herbs, to attend to themselves. And we know about licking of clay, that elephants and other animals, they lick clay. And we know that sometimes, especially pregnant women and some under 5 children, they also lick clay, giving us an example of 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 an example of folk medicine. Okay, so but if symptom persists, the sick individual will now seek the attention of traditional medicine practitioners. And in the present day, they can see a medical doctor. Okay, and these practitioners, especially traditional medicine practitioners, they have remedies, and these remedies are known to them. These remedies are different from the folk medicine. They are known only to these traditional medicine practitioners. Okay, and they know this secret medicine are known. They are become known to these traditional medicine practitioners, either as heirloom, that is a parent transferring the knowledge to their children. Okay, it can also be transferred through apprenticeship, and at times people buy the remedies with a fee. At times people buy the remedies with a fee. So, but a lot of these remedies used by traditional medicine practitioners, they have been analyzed and found to have little or no active ingredients. So they have been analyzed and found to have little or no active ingredients. So, but they have been found to be effective. At times, they have been found to be effective in certain circumstances. And this effectiveness has been attributed to a placebo effect. This effectiveness has been attributed to a placebo effect. And placebo effect has been defined or is defined as the benefit a patient gets from a treatment that is not as a result of the actual treatment, but because of the belief in the efficacy of the treatment. Okay? So this is the reason why the remedies of the traditional medicine practitioners, the reasons why they are effective is because of placebo effect. So the placebo effect, but for a patient to have that placebo effect, the patient will have to be convinced about the efficacy of the medication. And the traditional medicine practitioners, they do things to convince the patient. For example, the herbalist will say incantation, as if to invoke power into the herbs. He will collect the herb in a certain way, to make sure that the patient is convinced that even if he knows the herbs, but the herbalist has invoked extra powers into it. For witch doctors, they go into trance. They go into trance. They go into trance. And yes, because what they do is to cast out demons. So they have to make a display to convince the patient, and of course his relations, his or her relations, that he has done something. So all these placebo eliciting embellishments can be found in every form of faith healing. Every form of faith healing can will usually involve convincing the patient to believe. So it's not just traditional medicine practitioners that try to elicit the faith or try to elicit the placebo effect, but even faith healers, Christian faith healers, Muslim faith healers, and that's why they will insist, do you believe? Have faith. Have faith. Do you believe? Do you believe? Have faith. All those ones is to convince people, convince the patients that whatever they are giving them, be it anointing water, be it anointing oil, which is of course olive oil, that it has power much more than what they contain or what they represent. Okay. So for the epidemic diseases, remember we said epidemic diseases are usually a community effort. And in most communities, they will have what have been called chief priests. And chief priest is the responsibility of the chief priest to lead the community effort to control epidemic diseases. So the chief priest that leads the community efforts in the control of epidemic diseases. And then, yes, the chief priest, and we have chief priests not only. So when a chief priest can be a medical practitioner. He can treat patients. But when he treats the patient, he is not just interested in the patient, but he's interested, his main responsibility is to safeguard members of the community. So if he feels that the patient is a threat, he can take actions. He can take actions that may be detrimental to the patient. For example, the patient may be ostracized. The patient may be ostracized, placed in quarantine, or isolated. And we have all this, not just in the chief priests of our traditional societies as depicted in Nollywood movies, but also the high priest of Israel as stated in the Bible. They all do things to control, to safeguard the health of the general public. And at times, even the culprit, the person that brought the strange disease can even be killed. Can even be killed. Can even be killed. So we have gone through the history and then the placebo and the folk medicine and what are things that are being done to invoke the placebo effect in the patients. Okay, I don't know if there are questions or comments before we move on to the other traditional medicine practitioners. Do we have any question or comments?
Hello, Prof. Good evening, Prof.
Yeah, good evening, madam.
Please, sir, I want to ask a question, maybe based on the last lecture you had. That's the one before this, because you mentioned the Sapona cult, how they were spreading the disease. So when the man got initiated into the cult, that was when he discovered that. So I wanted to understand, is there any evidence that from what he saw to show that they were actually spreading the disease, or was it just an assumption? I don't really understand that aspect.
Okay, it was the reason why he got initiated. You know, secret cults. They are called cult because they have secrets. Those secrets are not known to everybody. So he suspected that they were spreading the disease. After all, it was in their interest for people to get infected and die. Because anybody that died, all his properties will be confiscated, just like what those Okija people were doing. So he got initiated, and his main purpose of getting initiated wasn't to worship, wasn't to join them, but to know the secrets. So he actually caught them red-handed, spreading it. Okay. Yes, Emusere.
Okay. Yeah, good evening, Prof.
Good evening.
Thank you for the lecture. My question is based on the second section. So I want to know, talking about the placebo effect, is it that with proper marketing and convincing and all that, the human body has its own way of clearing this disease, seeing that the agents that they were given didn't actually have the active ingredient to carry out the function for which they've been marketed?
No, actually, they are mostly effective against mental diseases, mental health problems, or things that have to do with the mind. For example, pain. Pain. Yes, pain. Like the Chinese and the acupuncture. They just put small needle and they give you a tweak. A tweak. And people, the pain will go. But they are not so effective in infective diseases. They are not effective against, say, infection. If you have malaria, it may not. And that's why we are also very, very not too we'll try as much as possible not to encourage it. For example, if somebody has if a child has malaria and their malaria is manifesting with fever, and if the mother kept on doing what they call tape sponging, pouring water, and or even give paracetamol, she hasn't cured the thing. The malaria parasite will continue to destroy the body until the child will become anemic. So placebo, they are mostly effective in against mental problems.
Okay.
Yeah. Yes. Enufi. Sorry.
Yeah. Good evening. Yeah. Good evening.
Yeah.
Prof.
Yeah. Good day. Thank you for responding. Yeah.
Yeah. Prof, please, my question is, I'm having network issues. So I don't know if you hear me.
Yeah. Well, yeah. We can hear you.
Yeah. Okay. My question is based on the mitochondria you spoke about, because I get to know what we're taught, like it's the powerhouse of the cell. So I don't understand.
Yeah, it's a powerhouse. Yeah,
well,
it's a
now,
powerhouse,
I
but
don't,
it
you said
has
something about disease. Yeah. I want to understand.
yes, no, it has genetic materials in it.
Okay.
Okay, that is the only organelle of
Yes,
the
sir.
cell that has genetic material. The other, all the other genetic materials are found in the nucleus, which is contributed by both parents.
Yes, sir.
Yes, so that's why they said,
Yes, sir.
because it has its own genetic materials,
Okay.
that it must be an extraneous thing.
Okay.
It must be extraneous.
Okay.
Okay, so that is the reason. Yeah.
Okay, that's why
it's considered
diseased, like it can be diseased. Okay. Hello?
Yeah, that's why it's considered as an infection.
Infection. Okay.
Yes.
Thank you, sir. Thank you, sir.
Okay. Okay. Kofi.
Yeah, hi, Prof. Good evening. Can you hear me?
Yes, I can.
Okay, so you mentioned folk medicine and then you related that to the fact that animals also do practice that, and most of the times it's been around them using leaves. But my question is, there is a place in the Yankari Game Reserve where they said animals do go to eat sand.
Yeah.
And they get well, but I really don't understand what plays out. So I just want to have some level of clarification.
That is exactly what it is. Because I'm sure that particular place has some minerals.
Oh yeah. Oh.
Yes, has some minerals, and so they identify it and they eat. And of course, we are also saying that the eating of clay is also found amongst human beings, especially those that are anemic, iron deficiency. I don't know. I think it's not as common as it used to be when I was growing up. Now, pregnant women are usually given ferrous iron tablets. But previously, a lot of pregnant women were anemic. And in that state, their sense of smell changes towards, and it pushes them to go and lick clay. And we call it pica. And I also know that when I was growing up, there are some children that are fond of going behind to lick the clay used that was used in building houses in my place. But it has to do with that change of that craving for death. That is caused by iron deficiency, anemia. Okay.
Okay. Thank you, Prof.
Hello, Kathy.
All right, Prof. Thank you very much, sir.
Yes.
Most of my question has been answered, though.
Okay.
But a quick one. Can we say that the pork practices are the same thing as traditional practice, just from what you just explained now, the eating of clay herbs and all of that.
But the one known to everybody, folk medicine, are remedies known to everybody. But there are also other traditional practices that are known to native doctors. Those ones are not folk medicine. Yes.
All right, sir. All right.
Okay.
Thank you.
Nubia.
Sir, good evening.
Good evening, sir.
Yeah,
good evening, sir.
Yes,
okay.
Edwina, just hold on for
about...
Nubia. Yeah.
All right, sir.
Hello, Nubia.
Good. Yes, sir. Good evening, sir. Thank you very much for the lecture, sir.
Yeah.
So, sir, please, I want to ask if you could please take the definition of disease again. And my second question is, you said endemic diseases, they are constantly present in human population, and they have the ability to cause deaths, even though they don't do that all the time. Why epidemic?
Yes.
Sorry, sir. Okay. Why epidemic? They are not always present in the population, but when they occur, they kill a lot of people. So what I want to ask is, can an endemic disease also become an epidemic?
Yes. Yes, technically. Okay, let me start with that one. An epidemic is said to occur in two circumstances. One, a new disease. Two, a normal disease, anyway, what we can call an endemic disease, but it's occurring at a level that is not expected at that time.
Okay.
For example, if a community is used to having two cases, or having malaria cases affecting serious malaria cases affecting the children, under 5 children, if it turns out that it is now affecting everybody, both the young and the old, it has become an epidemic. It has become, it will now become an epidemic. As for the difference between infection and disease, technically, we like to make that distinction. Infection is the presence of a microorganism, while disease is when that microorganism is beginning to manifest signs, cause trouble in the body, manifesting as signs and symptoms.
Thank you.
Yes, although we try a lot of times we try to use them as if they are the same. Yes. Okay.
Thank you.
Hello, yes, Edwina, you can go ahead.
All right, sir. I wanted to get clarity about epidemic disease, endemic disease, and pandemic. And then I also wanted to know more about secret remedies. Secret remedies, are they also same as folk medicine?
No, they are not. We try to make that distinction. Folk medicines are known to everybody in the community. Secret medicine, we call them secret medicine because they are known to only the practitioners, medical practitioners, traditional medical practitioners, and they get the knowledge of this medicine through this
Please mute yourself now.
through apprenticeship, or through people can buy, or through mother or parents transmitting to their children. So those are the things. As per epidemic, pandemic, I'm sure that you are further down. I'm sure that when you will do the epidemiology course, they will tell you more. But epidemic diseases are restricted. Epidemic diseases, they occur in probably a localized place. But pandemic is the worldwide, as was the case with the COVID-19. Okay. Yes. Hello, Maxwell.
Sorry, Prof. Sorry, Prof, for interrupting. Please, colleagues, can we mute our mics? If you have answered asked question and if you responded to mute your mic. It's actually distracting the class.
No, don't worry, Kathy. The problem is once in a while somebody comes up with a muted mic. Don't worry. That's why we are the hosts and we try to control. Hello, Brenda.
Good evening, Professor Best.
Yeah, good day.
So my question is with the placebo effect.
Yeah.
You talked about that is mostly applicable to pain, but
not just pain, not just pain. I'm just saying that, especially when the thing is in the mind.
Okay.
Yes.
Okay, so it's more like a mental.
No. It's not just it's not just mental. You can feel.
Okay.
You can feel right. You can feel. You can feel all right. Okay. After it, but it doesn't. If it's an infection, it continues. Or if it is what is it called? If it's a cancer or something, it continues. It continues, but you may feel all right.
But
Yeah.
There are times where persons like females that have not been able to conceive for years. And then the placebo effect works on them. Like they just go to their pastors and they bless oil or holy water for them.
Yeah.
And then I actually feel like it's a mind something. And then they conceive. It's like
conceive.
a reality.
I know, and they will give testimony.
Yeah.
You see, the thing there is this. I will come later. We'll talk about Moses Maimonides. He wasn't a two-facer. Okay. Anybody that gives testimony after several years of inability to give birth, that gives birth to a twin or triplets. Okay.
Yes, sir.
Went for IVF. They won't tell you, but that is the rule of thumb. Anybody, they won't tell you. They won't tell you that they went for IVF, but they will tell you that it was a blessing. But that is what? That is, I know, I feel that it's not right. Because the person, people that have, people with similar problems, that we are listening, will not be encouraged to do the right thing. They will keep on waiting on the Lord.
Okay.
Yes.
But
So,
what about genuine cases?
No, Brenda, please, let's move forward. Let us not drag it. It can work. Placebo is so effective that any drug used in care, medical care or health care, must be proven to be more effective than placebo before it will be licensed for use. Okay. So is that serious? Okay, Chinonye, Rosemary. Hello, Chinonye. Rosemary. Okay. Hello, Innocent. Innocent Shekina.
Yeah, Innocent Shekina. Good evening, Prof.
Good evening.
Yeah, so my own question is also in the aspect of the placebo effect, where you said that it's usually seen among the traditional healers, right? Yeah, but I also feel that this placebo effect is also seen among this modern medicine, because I've seen cases whereby people take wrong medication and it then works for them because they trust that the medication they're taking is actually the right one and it happens to work for them and they get better.
I know.
So I feel that it's actually a thing of the mind.
Yeah, it is, and it's not just traditional, because all faith healers, even if you are a Christian or Muslim faith healer, anyway, they are called faith healer because they require faith, the faith of the patient. And how faith works is through placebo. It's as simple as that. Whether they are traditional or Christian or Muslim healers, they all use it. Okay. Hello, Henry. Hello, Henry. Hello? Hello, Henry? No, don't put on your video. Just unmute yourself. Unmute. Yes, mute is a microphone. Yes.
Sorry, sir. Good
Yeah,
evening,
go
sir.
on. Yeah, good evening.
Okay. Thank you for the lecture. It's very explicit and very clear. I'm in the modern current day practice. I just wanted to be clear about something. If you're dealing with a client directly that has proven that the traditional medicine is working, the placebo, and you clearly know that is not the right path or is because of the placebo effect. Even if you try to convince the client and the person refuses and they've tried it medically, what is the way forward? Like, is it just documentation and you let the client go, or you try to still talk on and try to make your points known?
Okay. Okay. Anyway, if they got well, probably they won't come to you except they came for validation.
Okay.
Is he?
Yes, sir. Yeah. Yes, sir.
Anyway,
they got well.
Because anyway, to get well, I have a personal experience. To tell you the truth, not what they show on as testimonies, but the behind, after the camera, after the rolling of the camera, what happened? I'll tell you anyway. This is a personal, although I have to anyway. Time looking at time, well, it's a personal story, but everybody who can share from it. My mom had a CA, and she was in great pain. So much pain that we said, let's get her to UCH for radiotherapy. She was in so much pain, all the pain relief. When you go, you can. That's when this tramadol that people have been abusing. That's what they is made for. And then she went for a crusade. And my sister called me that our mom has been healed. The pain disappeared. We were happy. But after 5 days, they called me. And my mom called me crying that it was as if the pains that she didn't have those 5 days, they have all been added together and she's suffering them. So that is the thing. And we will also begin to, because the diseases we are now treating are diseases that will take a long time. It's diseases that you need to diagnose early. If you don't diagnose cancer early, that patient is dead. So we have to be careful. But I'm sure we are not going to spend the whole day talking about placebo. I don't know if it is what Peter. Hold on. Hello, Peter. Is that what you want to say?
Anyway, actually, so I just want to add my own experience or add a point to that placebo effect.
It's all right because
I think many a time, as you said, it's all about the mind, and it works with the hormones, and many of the hormones are produced in the pituitary glands in the brain. So once you have that belief, you send a signal to your brain, and your brain will activate that hormones, maybe that is responsible for that particular problem. And before you know it, the patient may be healed. Before you know it, the hormones. I'm just thinking, I don't have any scientific proof to that.
Heal permanently. Okay.
I know it may not be permanently. It may not. It may be for the moment. Maybe after some time, the hormone may be deactivated.
Okay. It's
and the situation will
yes.
Okay, sir. Thank you, Prof.
Yes. Hello, Selena.
Hello, yes, Selena. Prof. Good evening, sir.
Good
yes,
evening.
Prof. Good evening, sir. Yes. Okay, so I don't want to like want us to keep like talking so much about the placebo effect, but my question is actually geared towards the same. So I happen to work in like the HIV program space, and then most times we get cases where, you know, these positive clients are, somebody will just come and say, my pastor said I'm healed, and then I no longer need to take these medications, and then adherence is now a problem.
Yeah, it becomes
so
a problem.
my question is out of concern for these people, because most times we ask them, okay, come, let's get your viral load result. Let's get your viral load sample collected and then get your viral load result. If by the time the result comes out, we are seeing that you have been healed, and hey, it's a different thing. But most of them will not want to come back. They'll say, we'd rather not get yes. So I want to know, is there more we need to do that we are not doing?
No, I think it's the irresponsibility. It's the responsibility of those the faith healers. The faith healers. Anyway, is one of the reasons why we study this history. It's one of the reasons. It's one of the reasons why we study the history, because they will need to understand the pathophysiology, that these things don't just disappear. And not just disappear. If somebody is not diagnosed early, cancer, that person is dead. And it cannot be, people will not present themselves for screening when they have been told that it's not their portion. When they have been told that it's not their portion. So those are the things that, of course, as public health practitioners, will begin to also think. But it is better to, anyway, it's a full program. We'll talk about communication and how to work with these powerful men of God. Powerful men of God. Hello, Onyinye.
Okay, sir. Good evening, Prof.
Good evening.
Good evening, everyone. Sir, please, I wanted to ask the difference between placebo and traditional medicine, because I know some people do take herbs that are made from, some of our drugs are plant-based. So I wanted to know the difference and if they have similarities or there's a difference.
No. Actually, placebo is to explain why they work, because a lot of the drugs used by our traditional medicine practitioners, the active ingredients in them are not much. The active ingredients are not much. So technically, they have no use. But they are still being found to be helpful to the patients, to those taking them. And that has been attributed to placebo. Placebo is defined as the benefit someone gets, not because of the treatment, but because of the belief in the treatment. So that is the thing. That is it. That is the thing. And then we are saying that the traditional medicine practitioners, they do things to gain, to elicit, to get the belief in, to get the belief of, or the faith, to make the patients believe, by incantation, by the ritual of healing. In fact, even some of these faith healers, you will know that they are very demonstrative in their actions. All those things are geared towards convincing the patient. Hello, Nelly. Hello, Nelly.
Good evening, Prof.
Good evening, ma.
Good evening, everyone. So still on the placebo effect, I will want to differ a bit. I don't want to believe that the placebo effect is all negative.
Because no. We are not saying they are not negative. In fact, they are very, very good. Because that is the reason why most treatment work? That is the treatment. No. So it's not. Nobody. I don't know. I think perhaps I have to change that impression. But we are saying,
Okay, sir.
But what we are saying, why they were being, anyway, we will talk about later. I think it's social medicine. We'll talk about where they may be negative and certain diseases.
Okay.
Yes.
Okay, sir. So to just add to that, because as a pharmacist, I know that there are a lot of placebo drugs that are produced in the pharmaceutical industry. And these drugs, they are mostly used for drug addicts to help them break free from that addiction.
Well, no, madam. No, madam.
So, since you said that we will discuss it further.
They are not exactly placebo. They're not exactly placebo. They are, when you want to break addiction, I think it's because of the withdrawal effects. You want to control the withdrawal effects. Those drugs are active against the withdrawal effects. But placebo, they are blank. They are blank, completely blank. Okay, but it's all right. We will talk. We'll talk more. Akre. Hello, Akre. Okay. Thank God. So let's just quickly talk about the traditional medicine practitioners. We have 5 of them in traditional African medicine. We have the herbalist, we have the witch doctor, we have the diviner, we have the chief priest, and we have the specialized practitioners. The herbalists, they heal with herbs. They heal with herbs, not the ones that are known to you. So they don't, you can't find them carrying about dogoyaro. They don't carry about dogoyaro. Instead, they will carry the herbs that are known to them. They're known to them. Usually, of course, we have said that at times those herbs may not be functional, may not contain active ingredients, but they have to do something to convince the patients. They say incantations and do a lot of things. These herbalists, most times they practice in their community, so they are not into anyway. They are not into tricks. But those that practice in the urban centers, they have been found to put a lot of drugs into their so-called herbal medicine. Into the herbal medicine. For example, STI, sexually transmitted infection, they usually claim to cure, to have drugs for sexually transmitted infection. But I just believe, and of course, if you analyze those their herbal concoction, you find that they contain a lot of antibiotics. They contain a lot of antibiotics, and I know because I suspect so, because during the colonial period, when those herbalists were more active, SCIs were said to be incurable, such that though anybody found to have spread gonorrhea during the colonial times, they were brought to the open market and flogged to discourage people from actively spreading the disease. Okay, so we have the witch doctors. The witch doctors, they cast out demons. They cast out demons, or anyway, we don't call them. It seems we don't like to call them demons when it is the native doctor casting out the thing. But we like to call them spirits. They cast out spirits, but before you can cast out spirits, you must have a power equal or higher than the spirit. That will enable you dislodge the spirit. And because of that, the witch doctor would usually weave fantastic story about their calling to convince people that they are not ordinary human beings, to convince people that they are not ordinary human beings. So at times they will just say that they were trained by Mami Water. Other times they said, in fact, other times they will say they stayed in 15 months in the womb of their mother. And those of us in the health sciences, we know that is serious postdato. no baby can survive 15 months in the womb. No baby. But we have found some people, some of these faith healers, and we know what they do. You know the reason, because they have to convince us that they are not ordinary persons. They are not ordinary persons. So they have that ability they are said to cast out these spirits. And spirits are actually, when people say they have spirit in them or believe that they have spirit in them, it is a classical sign of mental health sickness, illness, especially the one they call schizophrenia, aka madness. AKA madness. So if you doubt it, go and Google Snyder's ranked symptoms. Snyder's ranked symptoms. Google them, and you will see you see spirit, demons or spirits into that. So the native doctors are okay, though they are mostly involved in those the treatment of mental health problems. Treatment of mental health problems. They also treat what has been difficult, what has been found to be difficult to treat in the Orthodox hospitals. They are called culture-bound syndromes. Culture-bound syndromes. People behave in a certain way, became sick, and behave in a certain way in certain cultures. In certain cultures. Can be Obanje, the spirits, they get this thing. Those people, if you take them to the hospital, they are not likely to get better. They're not likely to get better. And they are not like, if you do a test, they are not likely to find any result. You are not likely to find any derailment, because it is completely mental health. And it is culture. It is unique to each culture. So those with this mental health problem will behave unique to their culture, unique to their tribe. So if an Obanje in Igbo land will behave somehow, but if he goes to, similar thing may not be found in Yoruba land, but there may be a difference. I know that there is also an example of this culture-bound syndrome. I think we can also Google culture-bound syndrome to know more about them. But they are diseases. They are mostly psychosomatic illnesses that are usually cured or treated by the witch doctor, which the Orthodox doctor may find it difficult to treat, except a psychiatrist with interest in their treatment. Okay, we have the diviner. The next one, the third one, is the diviner. The diviner is the one that makes the diagnosis. He makes the diagnosis. He makes the diagnosis, and he's able to make a diagnosis without taking history, without taking any history from the patient. But I think he's probably the most intelligent of these traditional medicine practitioners, because he is capable of spot diagnosis. He just look for telltale signs and then make his diagnosis. And of course, he doesn't take history, but he knows almost everything about the patient. He knows, being a member of the community, he knows about the family and social history of the patient. He knows if madness runs in the family, he's aware of it. And he's also aware of family community gossips. But when people come to shrine, they say things. Probably they may be discussing with other people. With even his apprentice. His apprentice may be the one taking the history. and then we relate it to the diviner, and the diviner will say it as a matter of fact. So you see how they are able to take history without the patient knowing that they have taken history. Okay, then of course, yes, the other one is the chief priest. We mentioned chief priest before. We are the modern day incarnates of chief priests of communities, because the chief priests of the communities may be health practitioners capable of treating a patient, but their interest is not just the patient. It's not the patient. Their main interest is to protect members of the community, to protect members of the community. Their roles are usually crowned, recognized and crowned in the community, and then giving that response and giving the respect giving the respect and as the mouthpiece of the gods, as the mouthpiece of the gods. Okay, then we have the specialized practitioners. These may be of other trades. They may be civil servants, they may be taxi drivers, they may be engaged in other professions, but they practice this traditional medicine. Their traditional medicine practice almost like a side hustle. So we have the TBAs, the traditional birth attendants. We have the bone setters. We have the phlebotomists. We have the massagers. We have the circumcisers and the others. The traditional birth attendants are very, very active. They help women give birth according to their culture and tradition. So that culture and tradition, there are different pattern cultures in different societies. Some cultures will want their women to lie. They lie on their back and give birth. Others prefer that they squat, especially while trying to expel the baby or push out the baby. Let me use that word. And then, of course, at the end of the thing, they have a way of entertaining the women, probably the pepper soup with the special herbs, and then placenta is given to members of probably the father to go and bury in their compound, so that to attach the baby to his or her father's compound. Okay, so these people, because they help men give birth according to their culture, they can outcompete a lot of persons, including consultant of obstetricians. These TBAs can outcompete them, but we know that they provide useful services, especially in isolated communities, but at times they are also engaged in harmful traditional practices like female circumcision, and their hygiene practices are not too good. Their hygiene practices are not too good. So there are also interventions to improve their hygiene practices, like the mama's kit. I don't know if you have heard of the mama's kit. Mama's kits will contain things, cut clamp, soap, gloves, and etc. Things that are needed for the hygienic delivery of the woman. Okay, so then we have the bone setters. Bone setters are also very, very common, and they're very, very popular. In fact, a lot of persons in our society will prefer to go to the bone setters. They will prefer to go to the same bone setters because of several reasons. One of it is that it is culturally acceptable. It's a traditional way of caring, of healing the fracture. And they provide personalized service, and they have very affordable fees. And the fees are said to be almost like a sliding scale. The fees are like a sliding scale. The rich pay more higher than the poor. The rich pay higher than the poor. And they also collect their fees not just in money, not just in cash, but also in kind. and the patient can pay, can use goat, can use fowl, can use yam, etc. to pay. So it's usually affordable. Then, but the problem is that they actually don't do a good job. They actually don't do a good job. And of course, I don't know what you have to ask yourself. If you think that bone setters do a good job, have you seen any patient treated by a bone setter that doesn't have a limp? Yes, they will always have a limp. Yeah, because it is almost impossible for them to put the bone back the way what the surgeons, orthopedic surgeon will call adequate apposition of the fractured end. Is difficult because of the pain. They don't work with anesthesia, so it's difficult. So that's why they have this problem of non-union. If a bone heals like this, small trauma, the person will fracture again. And of course, at times they use their splints. They use their traditional splint and tie the leg so much that it can cut off the blood supply, leading to gangrene. So when you hear, that when people go to the hospital, their legs are amputated. No, most times people go to the bone setters, get mismanaged, and before they are referred to the orthodox to hospital. So the amputation is as a result of the mistakes of the bone setters. So they will have the massagers. The massagers are common in communities such as in the Niger Delta, the riverine communities, especially amongst the Jaws, that believe that certain diseases are caused by the malalignment of internal organs. That certain diseases are caused by the malalignment of the internal organs. So what they do is to massage that displaced organ into its proper place. But the problem is that they massage everything. They massage everything. Like this child had a ruptured spleen because the massager thought that the enlarged spleen was an abnormality, and he tried to massage it out, leading to the bleeding, leading to the rupturing of that spleen. Of course, the child just survived but after a major operation. Okay, so but the good thing is this: the massagers, they can be considered as physiotherapists. They can be considered as physiotherapists. So they can do a good job. Sorry, they can play a role in healthcare. Then the other one is the phlebotomists. The phlebotomists, they try to treat diseases that are said to be caused by bad blood. They treat diseases that are said to be bad blood. So they make clarification and use their horn or their cup to draw out the supposedly bad blood. Okay. The problem is that their instruments are not sterilized, and because of that, one can easily be infected with blood-borne infections like hepatitis and HIV. So that's why we say that they should lay down their arms or their article of trade. Okay, the article of trade. So the other thing too, let's just quickly talk about disease prevention in traditional African societies. The only thing to say is that there are two types of diseases, natural and supernatural diseases, and they are prevented in different ways. Supernatural diseases are diseases that are said to be caused by supernatural forces, and they can result when someone breaks the taboo, the culture and tradition. And then in traditional society, health is beyond the social well-being, is beyond the interaction between people, but also between the spirits. And in traditional societies, you can commit a sin without knowing it. You can commit a sin without knowing it. And the sin of your relations can even be visited upon you. The wages of the sins of your relations can be visited upon you. So usually people will now go to the oracle on a regular basis to find out if they have committed anything, if there is any sin that is recorded against their name, so that they could do something to appease the gods before the gods punishes them. So the regular consultation of the oracle is a common way traditional Africans prevent the so-called supernatural diseases. And then parents are also taken care of, because it is believed that if parents are not taken care of, they can actually cause the child, and then that will be serious. And when they die, they are given decent burials, because it's assumed that if they are given decent burials, they will be given a high position. They will given a position of influence in the committee of the ancestors. And with that, they will be able to positively influence influence the life of their living children. Okay, and once in a while, spirits enter the house. So once in a while, native doctors are called in to drive away those evil spirits. And then protective charms are usually kept on the doorposts and the windows to ward off spirits that may come in, may try to come in through those places. And then there are also protective charms and amulets, protective charms and amulets to protect against these supernatural forces. Then, okay, there are also the ones due to natural diseases are the ones with obvious causes. And one of them is the animal totem. A lot of people in a lot of traditional societies, we almost human beings are said to have their animal equivalents. Human beings are said to have their animal equivalent. So those that are lions, that have a lions as their animal equivalent, will not kill or even eat lion, and so forth. And so forth. Those with monkey, those with yes, and then the weather. People are advised not to walk under intense sun, because they said, according to them, they believe that if you walk under intense sun, you absorb a lot of heat and then develop fever. The converse one is exposure to cold, especially children, that if children are exposed to cold, the cold will enter their body and cause pneumonia. Okay, and cause pneumonia. So all those things are avoidances carried out in traditional societies to prevent disease. And then women when women are seeing their menstrual period, they stay away from the community, because they are believed to be impure. They are believed to be impure, and then was in fact so much that they believe that even whatever they touch and will become impure and will be capable of causing ill health to especially strong members of the community, strong members of the household with fortified charms. So women, once they are in the menstrual period, they stay indoors almost throughout those periods. Okay, so these are preventive measures. And then we have talked about those traditional medicine practitioners. I don't know if there are questions or comments. We have already two of them. Hello, Celestina. Your hand has been up for some time. Hello, Celestina. Hello?
Yes, sir. Yes, sir. So I'm here.
Yeah.
So Santorio, you said something like it's not possible to be pregnant for like 15 months. So I have a relative like that's been pregnant. You know, whenever she goes to church, she'll come back and say the baby moved. Does it mean that the baby is still there or no more baby? So I know what to tell her.
Don't worry, the baby is at the back. The baby is at the back. The baby is at the back. I'm sure that she has not had baby before.
Oh yeah, these are first pregnancy.
Yeah, that is the thing, and I'm sure that anyway, there are lots of plenty things. We hear a lot of things there. We hear a lot of things. And before you know it, now she will come back home with a child, with a baby. Or we know how it happens.
Okay, sir.
Yeah, we know. Hello, Henrietta. Henrietta.
Yes, Prof. Good evening, sir.
Good evening.
Please, Prof, I don't know if I should wait until you round up, but I have a question, not really about the lectures, please. I don't know if I should wait.
No, go on. Let's take that. No, just
Okay.
go on.
Okay, Prof. Thank you so much, sir. It's about the school fees. Because when we had induction section with you,
yeah. Okay, about the commitment and the rest.
The next people that came said we have to pay additional money to the commitment fee before a student portal will
Yeah. The IT person said because these things are programmed. Our programs. He was talking about the difficulty of doing that. And then he said, if there's anything at all.
Okay, Prof. Then they are so can we go for 100 plus the commitment fee 200? You know,
No. What I'm saying now that the at all can even be 10. Can be 10. Apart from the commitment fee, can pay 10,000 and it will be opened.
Thank you very much, Prof. Thank you. God bless you.
That's what because he said I would have preferred that but he said there will be some it requires some work. Because all those things are programmed. So whatever you pay, it will be accepted.
Okay, thank you.
Hello.
God bless you.
Yes. Hello, Onyema, Kenneth.
Yeah, Prof, good evening.
Good evening.
Thank you so much for the wonderful lectures. So I really so much enjoyed the lecture. See, from onset and till now, I realized and I also believe that health is all about belief. That is my own deduction. So I believe that health is all about belief, because I have some set of persons that they've not been to hospital all their life, and they have some certain practices that I apply, even though beaten by mosquito. So, and they easily, and they drink it, they drink a lot of water, they go to a restroom and they pass and they are healthy. They say they don't go to hospital no matter what, no matter from time to time, no matter what, and their age.
They won't. No, the thing is this, the body, there's some longevity. A lot of things are there.
Yes.
Some people, even in my place, they used to say that even when there is an epidemic, people still live to become very old. So there are some people.
Yes.
Yeah.
Okay.
But a lot of longevity is both in the genes and in the environment. Yeah. Okay. Hello, Nubia.
Okay. It's just hereditary.
No. A lot of things. There are a lot of things. A lot of things are involved. Kenneth. Just for brevity, just to cut it short. A lot of things are involved. Hello, Nubia.
Yes, sir. Thank you once more again for the enlightening lecture, sir. So, sir, I would like to ask if you could repeat the syndrome you talked about. I think it's Snyder-Rand syndrome. I didn't get.
No, it's culture bound. Culture bound syndrome. Okay. Is it the Schneider?
Yes, sir.
The demons.
Yes, sir.
Yes, Schneider's ranked symptoms. Ranked symptoms. Yeah, just if they will give you an idea of, they'll just give you an idea of this what these demons can do. Hello, Valentine.
Thank you, sir.
Good evening, Prof.
Good evening.
Yes, thank you very much, Prof, for the lecture. My question is just very simple and straightforward. It's concerning kind of some sort of partnership, because from what we have learned so far and what we are seeing from anecdotal evidences, there are some suggestions that the traditional people, my medical practitioners, are trying their best in their own ways using their method. Like the case of the bone setters. I have a woman in my community that no matter how scattered that bone is, the herb she uses, her sister uses the same plant, but the root, she knows how, she was trained on how to use the same plant, but the leaf. So they use that to achieve almost the same result. But like you said, most times, almost all their clients usually will still exhibit some sort of limping. So I am thinking that if they can achieve that result, that somebody whose bone was even scattered can still be harnessed together and the person can walk, and then but the person is limping, does it not suggest that if partnership can come in between traditional and orthodox medical practitioners, might be after achieving that result, the person might be subjected to further operation, or is it not possible for that kind of partnership to work in this kind of situation? That's my question.
Valentine, I think there is need, because one thing with them is that it's cost effective, it is affordable. It's affordable. To tell you the truth, even as a professor, I will find it difficult to afford some of the orthopedic services. So I'll find it difficult because it's expensive. But what the Indians did or have done is to strip bare some of these things to make sure, because they have this intramodular nail, almost like a rod. They can just put it there and the person can walk almost the same the next day. But the thing is that that is expensive. So what the Indian did was just to make sure that they are able to produce them at cheap price. And then while in developed countries, they will put you in a room, put the gadgets, employ a nurse that will watch over, not a nurse, even 3 nurses that will watch over you, and the cost will be exorbitant. The Indians will just do the surgery and put you in an open ward where you will share a nurse with one where you will share with 10 patients. Yes. So the cost is less expensive. The problem with leg weight on scatter, where you are talking, is that if infection enter bone, it still know they come out so easily. What they call osteomyelitis. That's once infection enters. That's why we don't want to. We don't want. That's why they are not. It's not recommended that they treat compound fracture, because once infection enters the bone, you don't finish. You don't finish. Okay, it's all right, Valentine. But there is need for collaboration, and especially in making the costs affordable for everybody. Hello, Jonathan. Adeleye. Oluwafemi. Hello.
Good evening, Prof.
Yeah, good evening.
Yes, sir. Sir, you made mention of having pregnancy at the back. Sir, I'm not that clear about that, sir.
I was just saying, it's just to say that, these women, they say they have pregnancy at the back. They are not, although what they call pseudocysis. So don't say they are not pregnant. They are not pregnant. They'll say,
Okay, sir.
if you ask them, you say he's hidden at the back, and they will deceive everybody. At times they deceive them. At times is the special midwife that is deceiving them. Is making arrangement for baby facts to get baby from a baby factory.
Yes, sir.
Yes. No, that's why they have baby factories now. So they deceive everybody. At times it's just the husband that they deceive. The woman is aware. But sometimes the so-called midwife will want them not to even go to scan. Not to go to scan. Not to the thing they back. They back. And they are doing like that. If once they are able to get that baby, they will tell them to come. It's time to give birth. Immediately, baby don't appear. Yeah. Anyway, so that is it. Anyway, you have to. That is one good thing about our specialty. We work in the hospital, we work in the community, so we know things that happen in the community, all the rumors, all the things, all the gossips we know. So that's why I'm able to say that. Hello, Telema. Hello, Telema.
Hello, Prof.
Yes.
Hello, Prof. I've been raising hands since you've not called me.
Oh, Martha, I know can't see your hand though. I don't know. Were you raising it from where you were sitting? It has to be virtual, but you go on. Let's take care.
Good evening, sir.
Yes. Go on.
Hello, can you hear me?
Yes, go on.
Okay. Thank you for clarifying that issue of pregnancy at the back. I wanted to also ask that because it was confusing. You were sounding so serious with it. So I also needed.
Okay. As I said it.
Yeah, the first one you said it, you made mention of it. You were sounding so serious and so real. So I needed some clarification on that. But thank you for clarifying it more now. Okay. I wanted to, when the other lady made mention of concerning the IT talk, so I think I needed to also bring in my own about this thing after the commitment fee and then uploading your credentials. Then you said there's a fee that's supposed to be paid 12,000 naira. Hello, Prof.
Yeah, madam. You could have just when it comes to this registration, and let's just quickly finish this thing. Please. Although I answered her. I just answered what you were talking about the fee. Is it the 12? Okay, just complete. Just continue.
The
Let's go be
12,000
fast.
naira for the 12,000 naira, you know, doing that. They're supposed to pay to print out for the ones that uploaded their credentials online registration. So you said the 12,000 that's supposed to be paid to print out the credentials.
Hello, madam, I can barely hear you. Please, madam, please, let me just answer the other questions. Please, please.
Okay.
Hello, Telema, sorry. Please, yeah. Yeah, good evening.
Thank you for this lecture, sir. Please, sir, I don't know, I wanted to know the proper spelling of that syndrome. The syndrome that you have.
Is it the culture band or the what is it called? The spirits?
Yes, the mad people syndrome.
Sorry? No, it's not. It's the Schneider's ranked symptoms. It's not a syndrome.
Okay,
Schneider. Yes, Schneider.
Bro, please.
Wait, let me, I was taught in medical school close to 30 years ago. let me anyway, Telema, just type. Anyway, I will get it. I will get it. This period is easier to
Okay, sir.
even learn.
Thank you. Sorry.
But I was taught more than 30 years ago. So it does, yes.
Thank
Hello, SN. SN.
Okay,
Hello,
Prof. Good
SN.
evening. Prof, good evening. Thank you so much for your lecture. As always, I really enjoyed every bit of it. I don't know, there seems to be so many problems, different beliefs. I don't understand. Is it an African thing? Some years ago, I think 2 years ago precisely, one man almost fought me in the lab. I'm a laboratorian, medical lab scientist. He almost fought me because he came to do genotype for his children. He has 3 C-class, and he said, according to him, he said one was healed in a crusade in their church. So I did the genotypes and it still turned out SS. So this man almost fought me. I'm serious, it wasn't a joke.
No. It won't. It's not. It's not because they believe in I don't know. I really don't know, and I don't know who to blame. Is the false understanding? I don't know. I don't know, because those people are supposed to be educated. They have to know what is possible, and that's why in developed countries, even to preach in the television, there are certain things they can't. There are certain things they can't say.
Okay.
Yeah.
So that means we can say it's actually an African thing. Do we need
No,
kind
it's
of?
not. It's not. No, the only thing is that they have moved on. They have moved on. In the medieval period, several centuries ago, they were like that, but they have moved on.
Okay.
They have moved on. Previously they believed in faith healing, but they have moved on. I'm an Anglican, and in Anglican, our church, our main church is at the Canterbury. That Canterbury used to be a pilgrimage site where people went for healing. Right now, they no longer heal there.
Okay.
And even in the Roman Catholic Church, healing was all over in the medieval period. But right now, in the Roman Catholic Church, before a miracle will be recognized, that miracle will be vetted and certified certified by a team of reputable practitioners to be indeed miraculous.
Okay.
So,
okay,
but yes.
Okay, like from your experience, does it look like we are going to move out of these things sometime?
No, it will take time, but perhaps with better health care. Yeah.
Okay.
Yeah, but to tell you the truth, men of God that start their ministry with healing, they don't last. Their ministry don't last because the more the stories about healing will spread, the more people with more serious problems, health problems, will come to them, and they will find it difficult. When I was anyway, I think it happened to me as a young doctor. I treated somebody with I'm sure that is hepatitis A. So he had jaundice, and he was treated, and he got better. The next time I saw him, he came with somebody with yellowness of the eyes. He said, "Oh, I treated him. I cured him of his own." He came with somebody with yellowness of the eyes. When I examined that person had advanced liver cirrhosis. But on him, yes. So that is the thing I told him. No, they are not the same. But on him, the two illnesses are the same because they all involve yellowness of the eyes. Okay, Tammy, Tammy, is it Tammy? Yes, Tammy is Schneider's first rank symptoms of schizophrenia. I just anyway, just type anything that resembles Schneider and it will come out. Hello, Wally, Cyril.
Okay, sir. Good evening. Thank you so much for your lecture, sir. Mine is the area of this diviners, sir. I wanted to know, you said that they are one of the most intellectual among
yes,
this group.
very intelligent.
Yes, sir. Is it because they keep the history, the family history of the families within the communities, or that they have the supernatural power to be able to predict that?
Knowledge comes with when you talk, when you know, and you speak in a matter of fact. You speak with confidence. Don't give anybody, don't give the idea that you are guessing. And the fact that they are already seen as superhumans. All they said will be are taken. And I will give you, and I say they are intelligent because they do what we call spot diagnosis. When they look, they can put two together, and we can do it. And I've tried it, and I don't have any supernatural powers, because I was able to tell somebody that he is a Catholic, and I even told him where he worships, just by looking at him and the knowledge of the Roman Catholic Church. And I even told him where he comes from, the state. That comes with knowledge. Of course, the Roman Catholic Church, I saw him, I saw the signs, I saw his, what is it called now? I don't know. That's I don't know what
the bead, the chap,
yes.
Okay,
I saw
sir.
it. And I also know that Roman Catholics, they are not like, their churches are not like Redeemer, where you see you have churches all over the place. They worship in a big church. So I just pointed to the big church in that community, that is where he worships. He was surprised. He was surprised. You see? So, and that is what they do. And I also gave you this, I also gave the example of at times when people come, they discuss with the apprentice. Oh, the apprentice will come, waiting carry you come. You will say it, oh.
Yes.
You will say it. And the apprentice can relate it to the diviner, or diviner may be listening behind the curtain.
Okay.
You see? But when he comes, he will be telling you, as a matter of fact, this, you'll be surprised. How come? How come he must be he must be filled with the Spirit? That's why that probably that was the reason why he got that. Okay. Thank you very much. I think we stop here today. Tomorrow we are going to go the other way. Talk about disease control in Bible, in biblical terms. We'll talk about the Muslims, and then we'll talk about the history of medical services, medical services in Nigeria, so that next week we'll do some other things. Okay, it seems more hands are up now. Hello, Valentino. Valentino, you want to close us? Or is it outside? Hello, outside.
Good evening, sir.
Good evening, Prof.
Good evening.
Good evening, Prof. Okay, this is Valentino. All right, sir.
Okay.
Thank you very much for the lecture. Yeah. I just wanted to confirm we will be able to get these lectures and along with the slides the way it is.
No. Yeah. You will get the slides. I don't know if it has not been made available to you. We'll make sure it's posted on the platform.
Okay, sir.
Okay.
All right. Thank you, sir.
Hello, Osai. Hello,
Okay.
Asai. Asai
Saying hello.
Ndoka. Let's so that we can. Hello, Asai. Okay.
Yes,
Not
Prof.
this
Good
thing.
evening, Prof.
Yes.
Can you
Good
hear me?
evening. Yes.
Yes. Thank you. Thank you so much, Prof. I really enjoyed your lecture. The first two lectures or the first one, I think I missed it. I'm just seeing this third
Yeah, don't
lecture.
worry.
So
We will recap tomorrow briefly.
okay,
Sorry.
okay.
Yes,
So
because we have to run.
can you hear me, sir?
Go on.
I want to make inquiry. This is not on this class. I have been trying to pay my commitment fee. I don't know if it is network from my area. I don't know. So I plan coming to. I'm planning to come to Uniport on Tuesday to see if I can do it physically. I don't know if it is late by
guys,
then.
we don't collect cash. Just try and just try.
I know.
It's all right, Ndoka. No problem.
I know. I'm
no
not talking of
no problem.
cash.
At least you can for you. You can see us. Hello, Adeye. Adeye.
Yeah. Good evening, Prof.
Good evening.
Yes. Can you hear me, sir?
Yes.
Yeah. I just wanted to leave a comment that thanks for putting together this lecture. It's been a fantastic one, and I really enjoyed every moment of it. Thanks, sir. Thank you so much.
Thank you for his kind words. Yufi.
Sir.
Yes.
Good evening, Prof.
Good
Thank
evening.
you so much for this thank you so much for the amazing lectures so far. Actually, I left my hands up because I already raised before you said there was going to be a recap tomorrow. So I wanted to ask about the Nightingale. During that time, there was network challenge, so I didn't get.
Yeah. We are trying to say how the nurses came into being. It was nursing was a low. It was a profession of without much repute, but she came about and she was able to prove that good nursing can improve the recovery of patients. In fact, those soldiers during the Crimean War, they looked forward to her coming to attend to them, and of course she came with a lantern, so that's why they say the lady with the lantern. Okay, so when you see Nightingale being depicted, she's always depicted with a lantern. Okay, thank you very much. I think yes, tomorrow we are going to continue. Thank you very much. Yes, and I have to commend you for your contributions. That is why we said let's make it real time, to enable this interaction, And I also like the fact, you were all over the place. You are drawn from different background. You came from different background, and in course of this program, people are encouraged to share their experiences. They share their experiences. In fact, some students will call them expert students, because they are able, they have so much experience in one or two aspects of the lecture. So thank you very much. And tomorrow we will we'll continue. So have the best of the rest of the evening. Thank you very much. Thank you.
Thank you, sir.
Thank you.
Thank
you.
Thank you, Prof.
Thank you, Prof.
Thank you, Prof. Thank you so much, Prof.
Thank you, Prof.
Good
Thank
night.
you, sir.
Thank you, sir. Good
Thank
night.
you.
Thank you,
Thank you
Prof.
so much.
Thank you so
I
much.
appreciate you.
Good night.
Thank you,
Good
Prof.
night.
Thank
Thank
you.
you.
Bye, sir.
Thanks, Prof.
Good night, Prof.
Good night, Prof.